Now, once this child is unconscious, we want to make sure that we begin with an assessment. We're going to look, listen, and feel. The going from standing to laying down could have moved the airway. It could have dislodged anything. We're going to look in the mouth to see if there's anything obvious that we can finger sweep out of there. But the fact that this child went from conscious to unconscious is now the time we're going to activate EMS or call a code. So I'm going to call out to the bystander, hey, you in the brown shirt, go call 911. I've got a child who went from conscious to unconscious choking. I need an ambulance. Please come back. I might need your help. We've activated the EMS system or the emergency medical services in the area, and now we're going to go ahead and look, listen, and feel for breathing. This child is still not breathing. We're going to attempt 2 breaths. After the 2 breaths, do not go in, and I've repositioned and tried again. We're now going to begin our 30 chest compressions, 1/3 to 1/2 of the depth of the chest, and we're going to do 30 chest compressions and then reassess for the obstruction. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 up to 30. Look in the airway, check for obstruction. If you can see it, we're going to go in and hooking motion sweep it out and attempt 2 breaths. Neither breath went in. Reposition the airway. Attempt 2 more. Neither breath went in. We go back to the 30 chest compressions. We then go back and look into the mouth. If we see the obstruction, sweep it out, and then attempt 2 more breaths. This time the 2 breaths did go in. We're then going to assess for a carotid pulse, airway breathing, and then treat what we find accordingly.